I'm Dr. Peter Zelles, clinical psychologist in St. Paul, Minnesota, and this is the third in my series on COVID-19 and mental health. I haven't talked with you for a while. A lot of things have changed since we last talked. Most importantly, this is taking a lot longer than we thought it would. People were hoping that a few months would go by and we'd be back to normal, and it doesn't look like that's going to happen. We're probably going to be waiting until a vaccine comes along, maybe a series of vaccines that gets us the herd immunity that we need. The first vaccines may not keep us from getting the virus, may just keep us from getting extremely sick. This is the way influenza vaccines often work. And then we'll probably have a series of vaccines that will last longer and provide greater immunity. But in the meantime, we have to deal with this and the idea that it's going to take a long time. People are getting very, very depleted by what's happening. Unfortunately, the virus has become a polarizing factor, but it doesn't care if you're Democrat or Republican or conservative or progressive. The virus will affect you either way. It doesn't matter. And the virus never rests. Even though we're moving into the summer now, it's beautiful weather, people want to be outside, the virus hasn't gone away, and we still need to be alert and doing all the things that we've been told to do. Social distancing. Right now, wearing masks is extremely important. Washing hands, disinfecting, all of those things are extremely important for us to do. And the hard part about this is that it's an ambiguous threat. We can't see it. We can't see the virus. We know it's there. We only know that it's where it is exactly because certain people get sick. So it's hard to deal with that kind of an ambiguous, difficult threat. And the longer we go, people start to take risks, which is a frightening thing. Sometimes people start to get panicky when they've gone on for a long period of time with an ambiguous risk. And it reminds me a lot of a story about submariners. I was talking to an older sailor, and he was telling me the story about how when he was being pursued by a Russian destroyer, the response of the submarine is to dive deep and become very quiet. So they get out of range where they can no longer be found by sonar, but they still have to be very, very quiet. So what happens is the submarine goes down, turns everything off. Most of the sailors are confined to their bunks, and the few people who are left to work are doing it in stocking feet, and they can't talk. It's a lot of stress. They can't see the destroyer up above. They just know it's there. They don't know what's going to happen. In those instances, sometimes what happens is a sailor becomes particularly anxious, really stressed, and will start to make a lot of noise, talk, pound on the side of the submarine, giving away their positions. It's very dangerous. But essentially what the sailor is doing at that point is saying, I can't take this suspense and this stress any longer. Just kill me. I can't stand it anymore. There's some similarity to what we're dealing with right now. I think some people are getting to that point with the virus. Inside the office, outside of the office, I hear people talking about this all the time. It's a stressful time for us. And they just want to give up. And people are taking some risks that they shouldn't take. They're socializing much closer groups, bigger groups. They're not washing hands. They're not disinfecting anymore. They're generally taking the kind of risks that are going to get them sick. And some of them are even say, I don't care anymore. I just want to get sick. I can't stand it. They're showing those signs of that kind of submarine anxiety that I talked about. It's a scary thing. That's one of the things that happens when we have a long-term ambiguous risk. People get really afraid. They don't know what to do. The thing that we need to do at this point is start to recalibrate. We need to be thinking about this as a longer-term battle. It's going to be a while. It's going to be at least several more months until we're starting to come out of this. So we need to think about it differently. James Stockdale was a naval officer and a prisoner of war during the Vietnam era. And he talked about what helped him to survive as a prisoner of war. There was really two things. One was pragmatism, and the other was hope. And the people who had both pragmatism and hope were the ones who got through the crisis much better. Pragmatism that we have right now is this new perspective that we need to go longer. This is going to take us longer than we thought. And we need to be serious with ourselves and clear with ourselves about that. That's the recalibrating, seeing it differently. And the hope is having the firm faith that this is going to get better, and it will. This is very, very likely going to get better. This is not going to be forever, but we want to see it as clearly as we can in the best possible light that we can. Have gratitude for what is working and being clear with ourselves. We're not in jail. We're not losing our freedoms. We're just working to help other people. Because when people start to take risks as they're doing right now, it's not a threat to that person. It's a threat to the whole community. The things that we do right now affect all the people around us. And even if we may be younger and not as great of a risk to develop a really serious illness, although a lot of younger people are getting very ill, but even if we think we don't have that, we can be bringing the virus to people who are very vulnerable and will not survive. So we need to be thinking about this as a community issue. And people sometimes get this confused. They get confused about the idea of freedom and responsibility. And we need to be thinking about that really clearly from a psychological perspective. We have freedom. We also have a responsibility right now. And responsibility takes a few things. It takes courage. It takes sacrifice. It takes maturity to do those things. And the sacrifices we need to make are continuing to be careful, continuing to wash, continuing to disinfect, using masks, continuing to social distance. Stay out of those situations that put everyone else at risk. That is extremely important for us right now. This is not going to go away this week. It's going to be here for a while. So we need to recalibrate and maintain that hope. One of the things I often tell my doctoral students when they're heading off on their intensive training experiences, which are very stressful periods for them, is two things. One, if you have something that you do that helps you a lot during these times, if you have a passion, if you have a creative endeavor that you do that nourishes you, keep on doing it because it's helping you maintain your resources. You're not getting as depleted. Second thing I tell them is don't worry alone. You're going to worry. We're all going to worry. People are going to have waves of worry during this pandemic. That's natural. But the thing we want to do is don't worry alone. Share it with other people. Talk to other people. Don't be afraid to reach out. Listen to other people who are afraid. You don't have to have magic words, but just to be there and listen and acknowledge, help them maintain the pragmatic long-term view of this so that we're going to get out of it. So keep strong. Try to help other people. Maintain your gratitude. I'll look forward to talking to you again soon.